my name's Christy Bryant, and this is my movie analysis number 2 for NURB461 Fall 2013. I decided to do my second movie analysis on the movie Patch Adams, which was filmed in 1998, starring Robin Williams as Patch Adams, Daniel Loudon, Philip Seymour Hoffman, and Monica Potter. This movie was based on, it's basically a comedy / drama biography about a man named Hunter Adams with the nickname of Patch. He was an individual that had a rough childhood, and as time went on in his adult life, he became depressed and was suicidal. So he decided to check himself into a mental institution for his depression and for his suicidal thoughts. So as time went on while he was there, the movie goes into him telling his thoughts to a psychiatrist who, as time goes on in the meeting, Patch realizes that the psychiatrist is not listening to what he's saying, is not connecting with him on a personal level. He is just looking at him from the medical aspect. Patch then says things that are off the wall, kind of kooky, and the psychiatrist doesn't even listen or understand what he's talking about. Then he goes into a group therapy session with some people that are also there at the mental institution, and Patch decides to start cracking jokes in the group therapy session. The therapist that was in there with them got very upset by this, but the patients loved it. So as time went on, he decided that he thought physicians need to interact with patients and connect with them on a personal, emotional level, as well as treat them medically. Emotion and humor is an important part of the healing process, he thought. So he checked himself out of the mental institution and decided to go to medical school. He went on to medical school, and people doubted him the whole entire time that he was there, because in the movie he was the oldest person they had ever had attend first year medical school. In reality, when Dr. Adams went to medical school, he was actually appropriate age. That's where the movie differs from his real life. But in the movie, he goes to medical school, and he starts to use humor as a way of connecting and healing. They were told in the movie that they should not even attempt to interact with the patient until their third year of medical school. Well, Patch didn't understand why they thought this, so he went to a meatpackers convention and took one of their white lab coats, or one of their coats from the meatpackers convention, which looks like a short coat that a third-year medical student would wear in a teaching facility. So he decides to sneak into the hospital to start seeing patients. He goes into the room and he starts to use humor as a way of connecting with them. He went to see children who had cancer, and he would put a clown nose on and go in and play with them and crack jokes, and the children loved it. He would go into patients' rooms who were very sick and dying, and he would crack jokes with them, or he would ask them what one of their fantasies or wishes were that they wanted to fulfill in their life. And he met an elderly woman that said that all she ever wanted to do growing up was to swim in a pool full of spaghetti. So as the movie goes on, towards the end, he gets a swimming pool. He sets it up outside the hospital. He fills the whole entire swimming pool full of spaghetti, and he gets this elderly woman out there, and he gets in this swimming pool full of spaghetti with her to fulfill her last wish, and she loved it. Throughout the movie, the dean of the medical school was very against the way that Patch felt as far as dealing with patients, and told him he was not to be in the hospital interacting with the patients, that he was making a mockery of the medical profession, that they were not there to connect and interact with their patients, they were there to treat them and heal them. Patch did not agree with this, and ultimately he was kicked out of medical school for this. But they decided to reinstate him because he did have excellent grades. So they let him back in. As time went on, there was a couple of other medical students that he befriended, and they decided to open a freestanding free care institute called the Gesundheit Institute. They were treating patients while they were still in medical school, which is against regulations and against the law. You cannot practice medicine without a license, but they would treat patients there that didn't have insurance and treat them for free, and they did alternative therapies, and they did healing. They did healing with them as far as with humor, as well as with medicine. And treated them holistically as a person, and connected with them on a personal level that no other physician ever had attempted to do. As time went on, they got caught doing this and ended up getting in trouble, and Patch again was kicked out of medical school and was reprimanded by the medical licensure board. He appealed this decision and actually was reinstated back into medical school and was able to graduate. He thought that healing comes from within, as far as using humor and connecting with someone on an emotional level is far more important, or not far more important, but as well as important as the medical aspect. And as a nurse that works in a teaching facility, I am aware that as well. A lot of times medical students will focus on just the medical aspect and learn the disease process and learn how to treat that disease process, but they often forget to look at the patient as a whole. And when you connect as a nurse or a doctor with someone on an emotional level, as well as being able to treat them medically, the healing process goes so much smoother, I think, and I think a lot of times that we forget that as medical professionals. The movie, it was okay. I would have rather have seen them go by what actually happened in Dr. Adams' life instead of portraying him in a manner that truly wasn't the way that the story went. But it still was a good movie. I would have liked to have seen them portray it as it was in his real life. But I did learn from this movie, and it did bring up to me to make sure that when I'm treating patients and when I'm working with mothers and their babies, to some way, somehow connect with them on a personal level, emotional level, to reach their spirit, as well as try to make sure that I'm taking care of them in their medical needs as well. That's a very important part of the healing process, and to treat someone with respect and dignity, which everyone should be able to have in their life. I also will remember, after watching this movie, to remind the medical students that I work with on a daily basis, and my interns and residents that I work with every month, to make sure that they try to connect with their patient on a personal level instead of just looking at them as a medical diagnosis. and trying to learn how to heal them in that aspect as well. Those are important things, but treating them as a whole is what's important, and I think as medical professionals we often forget that. I'm glad that I watched this movie and I enjoyed it. Thank you.